As Mr. Johnson stated, my name is Tarik Bean-Darell. I am the saliva testing coordinator for the molecular diagnostic lab. And my sole responsibility is to focus on testing using the saliva PCR test throughout the island and coordinate any testing that needs to happen within the community as well as in the school. So this evening, I'm actually presenting to the group of you to discuss what the saliva PCR testing strategy we have implemented for both public and private schools across the island, going from preschool level right through to the senior schools. So if everyone can look at the screen, here's a presentation that I have for all of you. I have given a similar presentation to the principals and school leaders, as well as the teachers and other staff in the school system. It's been tweaked slightly for teachers as well as parents, just so you can have a better understanding of what we're trying to push going forward within to the school system. So, the objective of this testing. So basically, the objective of the saliva PCR testing is basically we would like to screen different sections of the student population in a 4 week window. And in this 4 week window, it is going to help us identify if there's anyone that is in the school that may have the SARS-CoV-2 virus, also known as COVID-19. This screening process also helps the health officials to identify persons who may be asymptomatic or have been undetected that may enter into the school system, because you do have children that may claim that they have allergies, or parents send students home, send students to school, just have a slight cold. But there are cases where these children that are going to school who are or believed to have a cold or allergies may actually have the virus. And the screening also helps us, as well as other health officials, to swiftly identify the exposure risk and put in the proper health and safety protocols needed to isolate those individuals to prevent the widespread of this virus. We have been doing the saliva screening now since about September last year in Bermuda. We first started in the rest homes as well as in the Bermuda hospital for their staff there. So we decided we are going to move on to the school system to help screen these students, to make sure that we keep schools open as long as possible so that we don't have to shut down an entire school building, and we can isolate those infective cases as soon as possible and isolate those groups before it can do a massive spread throughout the school. A lot of people have participated in the screening process in the last couple of months, whether it be in the school system. I know we did one preschool, Devonshire Preschool, and we did about 7 primary schools leading up to the Easter break. But throughout the week, we actually have the community testing sites both at Penrose Wharf as well as the Star of India that also offer saliva testing. And I know this weekend we also had 3-day testing for the saliva PCR test at St. Paul's Centennial Hall. So many people are aware of this test, and people participate in this test, and some haven't. So what I'm going to do is go through the actual screening process and how it actually works. So the first thing is, when you attend saliva PCR testing screening, you cannot eat, drink, chew gum, or smoke at least 30 minutes before. Is that if you eat, drink, chew gum, or smoke, it can cause your sample to be rejected and the virus may not be detected because other chemicals that are in your food or in your smoke or in the gum that you chew or what you drink can basically um, can basically hide the virus within your saliva, which would then therefore lead to a false negative. So we try to make sure anyone who takes the test doesn't eat, drink, chew gum, or smoke at least 30 minutes before. And the lab staff can actually detect if there's food in the saliva sample and will reject it. And you will be called to redo another test. And so basically, that's the main part in the beginning is do not eat, drink, chew gum, or smoke. This test actually involves is a tube that you spit saliva into, which is provided by the Ministry of Health. It is sealed and sent back to the MDL to be tested in our PCR machine and to detect for the SARS-CoV-2 virus, also known as COVID-19. The results of the test are then sent to both the doctor as well as the Ministry of Health. If you are negative, you will get your test results via email, approximately about 24 hours. It all depends on the size of the test samples that the lab has received that day. Like in the beginning of this recent outbreak, at one point we were getting over 2,000 tests. So sometimes people who normally wait 12 to 24 hours for a test actually had to wait 48 hours. So it all depends on how much samples that the lab is processing in a given day, but it's normally a 24-hour turnaround time. If your results are positive, the person will be contacted by the doctor as well as Ministry of Health officials about the next steps. And the one key step that comes next is that anyone who tests positive for the saliva PCR test will have to take a nasopharyngeal test within the next day or two after you've taken after that positive result has been confirmed from the saliva testing. And it stresses again, please note that all test results are sent to their private physician or GP. So if you have not received your results in a timely manner, you can check with your physician, you can call the hotline, or you can also email the MDL lab. So if it's been 48 hours or longer and you haven't received your results, there can be an issue when it comes to email or an error in wrong email in the system. So just double check with either your physician, MDL lab, or the hotline in order for you to confirm your test results. So what we're asking from schools, and this is what you need to know, or what's happening with the relationship between MDL and school. So my position as the coordinator for the saliva testing is to basically coordinate testing throughout the island, where I have testing teams going to each individual school to test 25% of the student population each week. And the reason why we want to test 25% of the student population is so that we can continuously monitor every class on a weekly basis. And one of the reasons why it's 25% is that if a child tests positive, or one or two children test positive, there's a high chance that majority of the entire class is positive. So now if a child tests negative, or 4 out of 8 children, so 4 out of 12 children in that class test negative, there's a greater chance that that entire class remains negative. So this is the reason why we want to continue to test 25% of the student population, is that we're always monitoring every single class at each week. So it's not like where for preschool you may say teacher Richard's class gets tested this week, but then we won't see that entire class for a whole month. So we have now neglected an entire class from testing in a month span, where if we do 25%, we are now looking at the class on a weekly basis. And so what the school does is they provide a list to the lab of what staff and students will be tested. Yes, staff as well will be tested. And just for your reassurance, I'm actually going to show you the risk categories of how staff will be tested within the school system. So teachers will be placed in a risk category depending on how they move throughout the school building. So your principals, administrators are some folk in the schools that move from class to class or interact with many different bubbles. So you heard the word bubble before because the children actually remain in bubbles to keep them safe throughout the school day, and they very seldom interact with other school bubbles. The goal is to figure out what teachers are moving from bubble to bubble so that we can continue to mitigate any chances of the virus spreading throughout the entire school. The next thing is the schools will actually designate a room where testing will take place. And this room will basically be kind of isolated away from the rest of the student population and always sanitized on a regular basis to make sure that anyone who enters the room during testing procedures knows they're in a safe, clean environment. You, as well as the principals, administrators, and teachers, will always know what days testing takes place. And further on the slide, I actually will give you I will show you an example of what a weekly test schedule looks like for the saliva testing team. If the student, then we also have another group of students within our system, and those are students who fall on functional skills as well as the autism spectrum disorder. And we do have also day and module being students. So these students will be put on a specific list because their ability to produce saliva and spit in a tube will be a lot harder than a more higher functioning student in a classroom. So we will actually have specific guidelines and testing for those students separate from the students in the general population. Like I said previously in the slide before, is the risk categories. So as you see in front of you, we have three risk categories for the school staff. And that includes custodians, that includes school administrators, that secretaries, anyone that works within that school. If there is a speech and language therapist that comes in and out of the school, if there's a reading specialist, if there's a OT, they will also fall under this category, these three categories. So when I say high risk, we're talking about teachers and staff that move throughout the building and interact with many different bubbles. We're also talking about teaching specialists or ministry of health specialists that use multiple schools and work with different children from different schools. So you may have a child from work preschool that's worked with teacher so and so, but that teacher also goes all the way to Southampton Preschool or Lagoon Park. So those teachers and staff will fall under high risk and will have to be tested once per week. This is because we're trying to avoid a potential super spreader event. Because if that teacher or staff member goes to one school and accidentally picks up the virus, they can spread it to other schools. And so we're trying to alleviate that by making sure that we test these teachers at least once a week. And we know that these services are needed in schools. So I know that the ministry or the Department of Education is not going to cut speech and language OT services within the school because they are crucial in the development of your children, especially in the preschool age years. The other risk category, we're talking about the medium risk. And these medium risk categories are staff or teachers that interact with probably one or two bubbles throughout the day or throughout the week, or staff that have decided to get vaccinated and are fully immunized. And when we mean fully immunized, we mean have the second dose with second dose with 2 weeks afterwards. So those people in that category will be tested every 14 days. And if you were a teacher or staff member that's in high risk and have been vaccinated, you will actually drop at fully immunized, you would drop to the medium risk. So you'll be tested every 2 days. Any staff or any staff within the school system that interacts in one bubble and remains put in that bubble throughout the school day will be tested monthly or every 30 days along with the children. So this is just basically an overview of what it actually would look like. So an actual snapshot, a picture of what I mean for 25% of the student population and how people move throughout the school throughout the day. So if you look at classroom 1 through 5, we are looking at 25% of the student population, but we're pulling 25% from each class, which will give you an average of 25% of the entire school population each week. So if you look on your left, it will say anyone in the light blue, students tested on week 1, anybody in pink tested week 2, and so on and so on. So we're literally just plucking students from each class on a weekly basis to screen them so we can see if we can detect the virus that it may be running throughout the classroom that could have been undetected. So you see the red bubble, red box in the middle. And that's an indicator of someone who's at high risk. And as you see, the arrows is pointing to every different class. So, like administrators and principals, they have a job of moving throughout the school and observing classrooms and observing teachers and students throughout their day to day and handing in reports. So, they are actually high risk because they're moving from class to class to class and interacting. And if they accidentally interact with a student or a teacher that may have been positive, the risk of spreading it to the entire classroom. And that's what happened in the current outbreak that we had. Why we had to shut down a few schools early is because a staff or a teacher may have interacted with we had the potential of interacting with a class that's positive, and that high risk staff member will still interact with other people. There's a high chance that those staff members could have came back negative, but to avoid shutting down schools because we don't know if that person is going to be positive because they have to quarantine for 14 days, we will be testing them on a regular basis. So the more you move around the school, the more the staff get tested. And that is to keep the staff safe, and as well as to keep your child safe. I also said that I would show you an example of what a weekly testing schedule would look like. And like Commissioner Richards said before, and I as well said, is that this strategy is going for both public and private schools. So basically, we had to figure out how we going to put in 44 schools tested in 1 week. So basically, we had to come up with a schedule to figure out how we're able to test the entire school system, both public and private, in 1 week for the next, say, 4 weeks. This is basically an example of what it would look like. So I will actually be sending teams to each individual school during those time periods, and they will make sure that those schools are tested. So for preschools, the schools are not very large. I believe the largest preschool is probably Ward Preschool on the island at the moment. So if you're talking about a smaller preschool like St. David's Preschool that may have, say, 20 students, we're
Well,
looking at 25%. So we're looking at probably 5 students a week being tested. And so that means we know we will get into that school as early as possible, test those 5 students, get that stuff sent to the lab so you can get your test results as soon as possible. The larger the school, the more testers I will send to the school. The smaller the school, the less testers are needed. But for the preschool level, we would need testers there to encourage because this is a self-administered test and anyone who has taken this test would know that it's self-administered, and what they're there is to coach and encourage the children how to produce the saliva in their mouth. So this is where when I was talking about children who are on the spectrum or children who have functional skills have a trouble um, producing saliva because they may have motor functional issues and things like that. And each school and administrator is supposed to send the lab a list, and the administrator send a list of students who fall in that category, so we can work out other test regimes for those students. And Dr. Weldon was supposed to be here this evening, like Mr. Johnson said. However, she was pulled away at the last minute to do something at the lab. But she normally tackles this part. But I'm going to leave this up for when I have question and answer period. So you can read the frequently asked questions that we receive that we were able to answer so you can see. And basically, if you have any questions that revolve around that area, you're able to answer that by reading the information below. So I will actually open the floor up to questions right now.
Thank you so much, Mr. Miller.
Mr. Johnson, can you just quickly go through the FAQs and summarize the responses, please, for the parents?
Okay, so the FAQs, the first one is it possible to take the test before they enter school and the return and the results go back faster than 24 hours? The basic answer is that they decided not to use the other tests so that we have as little risk as possible entering the school system. The accuracy of the saliva PCR test, that's another question. It's the same as the nasopharyngeal test from the lab's perspective. The exact same procedure is done at the lab. The only difference is it is less invasive and easier for those being tested. Why do you need to take a nasopharyngeal PCR test if the saliva test is accurate? The testing committee in Bermuda has not approved saliva testing to be a diagnostic test based on data from late 2020. Since it is not an official diagnostic test in Bermuda, or according to Pan American Health Organization, we're required to confirm a positive saliva test with a nasopharyngeal positive for it to be recognized nationally and internationally. They also make the point that for the recent outbreak, they've used saliva tests, and no one who was positive in the saliva test was negative in the other test. So far it's a 100% accuracy. What happens if a member of staff or student tests positive and they've already been at school? In the event there's a positive case, the Ministry of Health will be informed immediately by Dr. Weldon with the result, the school and year level. The health officials will then contact the positive case and at the same time contact the Ministry of Education, which will then notify the specific school. For private schools, the Ministry of Health would notify them. The overall goal is not to have a delay in the positive individual finding out and the school being notified. Will school principals or administrators be informed of test results? The school principals or administrators will not find out any individual result. MDL will provide a weekly summary of the weekly testing performed so they can be kept for school records and so that everybody involved is aware of what happened within the week. Could parents and children opt to be tested at one of the government testing sites? Yes. It is important that the testing site be made aware that they're testing for school screening so that the lab knows and they will not be tested again at the school. Okay, does anybody have any questions? Can we do the saliva test at the doctor's office? The answer to that is yes, isn't it, Mr. Bean-Darell, sorry.
Yes, they can do testing at the doctor's office, but at the moment, the doctor would just have to request to get a saliva testing kit from the Ministry of Health, which is you just have to call your doctor and say, I would like my child to do the saliva testing in the doctor's office. So any tests, we are not stopping you from getting tested by the doctor on a weekly basis or a monthly basis. But if you would like to do so, that is perfectly fine with us as well. What you would do is, because we don't want to double test your child in a week, all you have to do is indicate to the school that your child will be tested in their doctor's office that week, so that the school could eliminate that child off the list for testing, so that we're not the child's not being tested multiple times in less than 4 days.
Okay. The other question is, somebody said, I heard that you can, is it like the testing kits you can do on your own at home, like a pregnancy test? Are they getting this in Bermuda?
So this test that we actually do right here, the saliva testing, is actually a self-administered test. And talking to the teachers as well as the principal, the goal for the lab and the goal for us is for basically, and even though this is preschool age, so it'll be harder for them to self-administer the test. But the goal is for everyone to become more independent with self-administering tests so that we have least disruption within the school day. Any other test, I can't answer that question right now, but I would ask if Mr. Johnson could just make note of that so we could pass it on to Dr. Weldon and she could possibly answer that question moving forward for you.
Mhm. How long will this testing go on for? Is it only for when there's an active outbreak? It doesn't seem to be a foreseeable end.
So the goal is to continue this testing even when there isn't an active outbreak. And we find that if we screen students on a regular basis when there isn't an active outbreak, then that means we can actually isolate any cases before they spread even further. So we're looking at potentially starting in September, doing this on a monthly basis with the students and a weekly basis with the teachers, is so that we can keep the school year as normal as possible, so that come November or come next year spring, we're not shutting down schools again, because it's hard for the students as well as the parents or any as well and the teachers for the stop and start of the school year. So our goal is to add an extra health and safety layer so that we can keep schools open as long as possible.
Mr. Bean-Darell, I know you talked about September with the testing, but I do want parents to understand we're looking at testing starting this month in May through to
Yes.
June.
So yes, we're looking at testing hopefully as soon as possible this month and right on to June so that schools can remain open until schools finish at the end of June.
Basically, just to clarify, it's going to be it's hopefully preventing an outbreak, right? If we can catch it early. Is that the strategy?
Yes, so that's basically it. So the screening tool is more of like a prevention tool, is to try to catch the virus as soon as possible. Because we find that if we don't screen fast enough, that one positive case can now spread to multiple different bubbles within the school. And I'm not saying within the school day, because as you know, children, when they leave school, there are children that interact with outside the bubble, whether they're catching the bus or they're walking home. So if we can actually capture that child before they're able to interact outside of their bubble, then we can now know for sure that schools can remain open as long as possible.
Great. I don't know if you can answer this one. How much is this costing Bermuda? How much manpower? If you can talk about
So
the number of people that you have going around from school to school.
So with the saliva testing team, there are actually 10 members of the saliva testing team that actually are working at various different schools. And for children who fall on the spectrum, as well as the children in ASD, there will be a team of what we call swabbers that actually will do the oral swab for the students. So we're looking at about 15 members of the team that will be going on from different schools to help facilitate testing.
Okay. Are there any more questions from anyone? All those questions came from just one. What is the conversation to preschoolers about why? So a parent is seeking to know what they should be telling their preschoolers. I presume.
Um,
Richard, did
well, Ms. Rich, could you answer that question?
Say that again, Mr. Johnson.
what would be the conversation to preschoolers about the reason why they have to spit into a test tube?
I think parents, first of all, have to take into consideration their children, but there are some common messages around wanting children to be safe, wanting them to stay well, and that there are times when you're going to be at school that you may be asked to put saliva into a little container, and people are going to just check that to see whether you're well or not and whether others are well in your class, and that we want to ensure that you're being safe so parents can prepare them for it. And what I can do, because I would defer to the experts at the preschool level, our preschool leaders and our teachers, and we can get, a message that parents can use with their children. So I will put that as a follow-up. But I think they just have to talk about being safe, checking to see if you're well and others in the class are well, and letting them know in advance that they're going to have to spit, that it's okay because you're spitting into a little container. So just messages around that.
And also, if you do have a child that's feeling sick or has any allergies, try to keep them home until you get confirmation from a doctor that it's safe for them to go back to school. Because that's what we also noticed from this last outbreak. I don't want to speak too much onto it, but what we noticed is that a lot of people, this virus showed symptoms of the allergies. So a lot of people just assumed they had allergies. And around this time of year, many Bermudians suffer from allergies and not realizing that they were actually carrying the virus. So we also have to be cautious as well when sending our children to school to make sure that it's just allergies or it may be something else. So even if they do have allergies or they have a little cold or sniffles, consult with your doctor first before you just decide to send them back to school. This will help with these to reduce the spread of the virus within the school system as well.
Okay.
Mr. Johnson, I know that some parents are probably wondering about the test and, whether we just go ahead with it, etc. I do want to underscore that the testing takes place with parental consent. So we would need the consent of parents in order for students to participate in the saliva testing. I don't know if you want to say anything else about that, Mr. Bean-Darell.
Yes. Um, just want to piggyback off of Commissioner Richards. Anyone who participates in this test, legally, we cannot mandate, we cannot force, as well as staff and teachers. Everything has to be consent. So if your child has not consented to test, they will not be a part of the testing group. And the schools will indicate to the saliva testing teams that come to the school on which child has the consent to be tested.
Okay, so thank you so much. We had some questions that were submitted in advance. I think we've covered quite a few of them already. Somebody did ask what happens in the case of a false positive result. I think we covered that there. So far, the saliva test matches the PCR testing results. And then there was a question about, is it mandatory? We've already addressed that. After school programs, will there be any after school programs, Mrs. Richards?
Yes, there will be after-school programs. They have been, and I should say, Department of Health has given clearance for the Department of Youth and Sports and Recreation to hold after-school programs. They have had a representative linked directly with the key rep at Youth and Sport around the protocols and the expectations for children in the after-school program. So clearance has been given.
Okay. Right, there's a series of questions here which I think you might be able to address in general terms. The first one is, has anything significantly changed in the preschool safety and health protocols? We already know about the saliva screening. Is there anything else, Mrs. Richards?
No, the Department of Health has indicated across the school levels that the safety and health protocols will remain the same. However, they have underscored the importance at the various levels of children wearing their mask when they should. So we know at middle and senior, they have their mask on all day. At pre and primary, there are designated times. The hand washing is still a critical measure, no sharing, etc. So the safety and health protocols for preschools remain the same. Staff have just been asked to be extremely, extremely vigilant with executing those protocols.
And do you have a sense of how have the kids been managing all the protocols all along? Are they following it independently? needing reminders and help to carry them out? How has it impacted them emotionally in general?
Well, thank you so much for that question. So what we did at the beginning of the year with the preschools, with the assistance of Assistant Director Bushi, we gave them additional support, those who required it, to help students and staff get into the routine with children. Once the routines were established, we gradually pulled away that additional support. Anytime that a school does need support, the process is they link with their assistant director, who will be able to address it. If it cannot be addressed at that level, then the assistant director would bring it up to her supervisor and myself for us to work with the school to resolve it. Our position is that, we have to always be on standby to support schools if any challenges do arise.
Great. She's also asking about impact on social skills development due to these interaction, the restrictions and interpersonal interaction between students and other students and between students and teachers.
Impact on the social development of students.
Social skills development.
We recognize that across our school levels, given the introduction of protocols that require schools to operate differently, that there will be impact, or there has been impact on a variety of skills for students. And I would just encourage parents, as it relates to the social skills, social emotional, reach out to the school leaders, get some strategies that you can use at home. I would put myself in your position. What can I do at home to enhance what the school is doing and integrate that in evenings and on the weekends? So working collaboratively with the school to just reinforce the necessary skills, I think would be tremendously helpful.
And academic achievement, how has that, the disruption so far impacted academic achievement?
So and we know that because there has been a reduction in time for students, that will impact the acquisition of skills. Parents at the preschool level have an opportunity to go on to online so that they can view the data that the teachers are putting in, which will give them an indication of how their children are doing. Again, it's so important. The communication with your children's teachers is so important. You should feel free to reach out. Always start with that question: what's my child doing well? What are those areas where my child could use a bit more reinforcement? And then I just want to underscore that parents are children's teachers. They will learn from you, and so parents have to be in that equation. And again, what is it as it relates to those academic skills? What can I be reinforcing at home, and how can I integrate it into the life of my family?
Finally, have there been any COVID-19 positive cases within preschools?
We had 2 preschools with COVID-19 cases. 3 preschools, my apologies, 3 preschools.
Okay. I should say, if there's no more questions, the health officials, as you can imagine, are quite busy right now, and they weren't able to make any of our meetings. However, we've asked them to prepare a PowerPoint, which we will record this week and circulate it around. They're going to be covering things like an overview of the COVID situation as it relates to schools, reviewing all the safety and health protocols, talking about why certain schools were quarantined, and also talk about the outbreak response plan measures and vaccination. Okay, so that's coming on its way. Does anybody have any further questions or thoughts or concerns that need to be addressed now? That's a very good question. Does the Department of Health have any guidance on screen time?
On screen time?
Yeah, I'd like to know as well, Mr. Richards.
You mean having children online, etc., for Zoom lessons, etc.?
Yeah, I think that's a major concern. There's been a
It
lot of,
is. It is. And that's why we've made adjustments to the schedule to, restrict or at least reduce. So if a student was with their teachers 8:30 until 3, then you'll find that as parents that you'll be coming on or your children will be on for patches of time. Absolutely. We've factored that in from preschool at least up to the middle school level with our students.
and that's why I prefer in-person learning as opposed to
Well, we
remote.
recognize, yes, and there's a lot of research. Well, there is research to support that in-person learning, of course, is, that's the best possible learning environment for our children.
Yeah, she's saying primary one is all day on Zoom.
Primary one is all day. Primary one should have reduced periods of time. There should be pockets during the day where the students are not online.
Yeah. Okay. I should remind everybody that we do have the feedback form, which is in every scoop. The link is in every newsletter. So if there's any concerns that you have, any questions, suggestions even, you can just click on that link and let us know.
And we respond. Your questions and your feedback are important to us.